Coronavirus Disease 2019, COVID-19, pandemic's effects on sexual behavior among Americans are examined in a recent study that was just published in the Journal of Sexual Medicine. This study is based on a cross-sectional online survey that was carried out in October 2020 to address intimate partner violence, diverse partnered and lonely sexual activities, sexual functioning, and satisfaction. On March 11, 2020, the World Health Organization, WHO, classified the COVID-19 global outbreak to be a global pandemic. The majority of nations implemented stringent mitigation measures to stop the virus's transmission, which resulted in little interpersonal contact. It is therefore probable that these efforts had an impact on human sexual behavior. Experts in sexual health are worried about the pandemic's potential detrimental impacts on sexual health. To this end, there is a rising concern about increases in sexual dysfunction and relationship conflict. In addition to potentially limited access to sexual health care, relationship conflict may also potentially increase intimate partner violence. Sexual health is essential for physical and mental well-being. Therefore, the public health response to the global pandemic requires attention to sexual health as well. There is preliminary research that supports the concerns of sexual health professionals. According to a national survey conducted in the United States, 34% of couples reported COVID-19-related relationship difficulties. Moreover, less solitary and intimate activities were reported in couples that had a greater disagreement. Another American survey on married persons found that 32% of respondents said the pandemic had put a strain on their relationships. In contrast, 74% of respondents said their marriages had grown stronger. It's interesting to note that there were conflicting findings regarding the effect on sexual frequency, with 32% reporting an increase and 20% reporting a decrease. A longitudinal survey revealed that stress related to the pandemic increased relationship satisfaction and decreased sex drive and sexual activity both within person and between person. Other studies from the United States and other countries have suggested additional changes in sexual behavior, like decreased incidences of casual sex, increased use of pornography, and sexting or cybersex. One study observed that exploring novel sexual activities during the pandemic was protective against the negative effects on sexual satisfaction. Many of the published studies have limitations due to the small sample sizes, convenience sampling, and exclusion of particular demographic categories like women, LGBT+ people, or married couples. Additionally, the majority of the investigations that have been published thus far were carried out during the early stages of the epidemic, when lockdown procedures had just recently started. The latest study built on the findings of earlier studies with a special emphasis on the period after the pandemic has been going on for a while. The administration and the populace already had several months to adjust to the unique circumstances at the time the current study was done. This made it possible to continue monitoring COVID-19's effects on sexual behaviors months later. 1,051 people from all around the United States were recruited for this study using the Amazon Mechanical Turk (MTurk) platform. Participants were required to provide answers to questions on their past sexual behavior, sexual and romantic pleasure, physical and sexual assault, demographic information that was pertinent, substance usage, COVID-19 exposure information, and depressive symptoms. All participants were also asked 5 questions to check for attention while filling out the questionnaire. Statistical analyses were employed to compare data before and after the start of the COVID-19 pandemic. This poll found that there has been a little decline in partnered sexual activity. The usage of pornography and masturbation by men both slightly increased. Intimate partner violence or relationship satisfaction did not appear to have changed based on the data. Both men and women did, however, perceive a little decline in sexual enjoyment. The women also noted a little drop in their desire for sexual activity. Hookups, casual sex, and the number of partners all significantly decreased. Notably, the majority of individuals reported feeling less sexually satisfied. These decreases could be linked to depression symptoms, relationship status, and the value people place on social isolation when taken as a whole. Less than half of the participants who engaged with casual sex partners before the start of the pandemic discontinued this behavior completely after the start of the pandemic. In addition, participants reported waiting on average 6-7 weeks before involving in casual sex. The COVID-19 pandemic may affect the birth rate, post-pandemic sexual behaviors, and psychological health in the long term. Therefore, future research should propose ways to minimize the negative outcomes. Sexual health therapists and healthcare providers should be equipped to address these issues. What do you think of our video? Let us know in the comments below. If you enjoyed this video and would like to hear more from us, please subscribe to our channel and turn on notifications before you go. Thanks for watching.